Nepal has been consistently reducing its maternal mortality. The number of maternal deaths dropped by almost half between the year 2000 and 2010. However, the country still witnesses yearly deaths of 190 expecting mothers out of every 100,000 live births. Here, in rural Nepal, almost 70% of children are born at home, and half of those home childbirths happen without any professional assistance. Bindu gave birth to her baby boy 5 days ago with the sole help of her sister. The delivery turned out to be complicated and Bindu's life was in danger. Unassisted birth at home is still, however, a tradition that prevails in many Nepalese regions.
बेद मात्र लागेको अनि समातेर बसिरहेको मैले 8:30 बजे बच्चा जन्म्यो के रे 8 बजे है अनि 8 बजेपछि अनि 9:30 म बजी 9:30 म पनि उ झरेन सल झरेन अनि मैले पनि 3 बच्चा नै पायो अनि घरमै पाएको अनि होला नि भनेर नर्मल बेद हो घरमै हुन्छ भनेर राखेको मैले त यो अलि कस्तो कस्तो भएर उ भयो
Nepal has already achieved the Millennium Development Goal of reducing maternal mortality, but the challenge is to make this progress uniform across Nepalese population.
Maternal mortality in Nepal is one of the major problems. Although Nepal has many programs to reduce maternal mortality, and we have tremendously declined the maternal mortality. However, this number is also very high and I must say it is unacceptable.
To help address this situation, researcher Devendra Shrestha and colleagues from the Policy Research and Development Nepal conducted a policy simulation to compare the impact of two policies that are being implemented by the government. The study is supported by the Global Development Network as part of its Strengthening Institutions to Improve Public Expenditure Accountability project.
Because of the difficult geographical terrain, there has been a problem of access to services. So, government has been in fact promoting 24-hour birthing centers with the deployment of a skilled birth attendant in the outlet. The second alternative could be placing the skilled birth attendant in the community itself so that they could be more mobile and then could provide the required services at the community level.
24-hour birthing centers are already operational in some villages and people are keen to use them. This is Krishna's first child and he made sure his wife Sunita did not deliver without professional assistance.
अब रगतको खाँचो पर्न सक्छ रगत धेरै बग्न सक्छ त्यसैले चाहिँ मैले अनि तर गाउँमै चाहिँ मैले देखेको छु हैन घरमा गर्दा अब हामीलाई त्यति थाहा हुँदैन हैन किनभने हामीसँग त्यति जानकारी हामी सबै कुरो जानेका हुँदैनौं यहाँ तालिम प्राप्त स्वास्थ्य कर्मीहरू दिदीहरू हुनुहुन्छ उहाँहरूले असल तरिकाले सहायता गर्नुहुन्छ त्यसै कारणले
However, Nepal's mountainous topography makes it for many almost impossible to go to a health center. Roshini was the first in a family to deliver assisted by a skilled birth attendant.
एन्डस बोलायो भने पैसा पनि खर्च पनि धेरै लाग्यो अनि कहाँबाट ल्याउनु पैसा जोड्दा जोड्दै अब घरमै पाउँछ अब त्यो दिन बेद लागेपछि बोलाउनु गयो अनि बोलाएर ल्यायो बोलाएर लिएर अनि उहाँले सहयोग दिइरहेको छ अब बोलाएपछि त अब एकछिनको बाटोमै आइपुग्छ अब दिनभर लाग्दैन सजिलै छ हामीलाई
Devendra calculated that the training and deployment of a sufficient number of skilled birth attendants like the one who assisted Roshini would cost around $28 million. The average cost per delivery would be 4 times lower than that of a delivery in a set-up birthing center.
It's very obvious that the government cannot in fact establish 24-hour birthing centers each and everywhere you see. Again, there is a resource constraint. The second option, the deploying more number of skilled birth attendant at the community level is more cost effective.
By deploying skilled birth attendants rather than setting up birthing centers, 7 times as many beneficiaries can be reached across Nepal's remote and mountainous terrain. According to Devendra, deploying skilled birth attendants is also a childbirth policy that has a high chance of being adopted by communities where unassisted home childbirth has long been a tradition. In addition, better access to locally deployed birth attendants would allow a gradual withdrawal of financial incentives introduced to encourage institutional delivery. This would represent further savings for the Nepali government.
Initially, we used to thought that only this monetary factor was governing in Nepal's childbirth and all. Later on, after instituting this free delivery, also see around 50% of the deliveries are occurring at home. So, home delivery is not safe, but if some skilled birth attendant is there, okay, it can be accepted. We also believe in evidence-based practice. So that's why I believe that research is most important for formulating policy.
It was indeed thanks to a skilled birth attendant that Bindu's delivery ended up safely.
त्यो सल नझर्ने बेलामा उ त्यहाँ दिदी छ रे अनि आफैले देखाउन गयो म पनि गएँ अनि दिदीले बोलाएर दिदीहरुले पानी छापेर उ गरेर भएछ अनि त्यहाँ दिदी आउनु भयो र अनि त्यो सल निकाल भएको अनि राम्रो भयो अनि